morning, Abby. How are you?
Good. It's so nice to meet you.
It's nice to meet you too. Welcome to our company.
Thank you for having me.
Okay, so to start off, I just want you to tell me a little bit about yourself.
Okay, yeah. So I'm Abby. I went to undergrad at Tennessee Tech in Cookeville in psychology. And while I was there, I ended up discovering more about occupational therapy. So I just finished up my program at Tennessee Wesleyan out of Knoxville. I really enjoyed my time there. While I was there, I kind of learned that I really love to go on hikes, really like doing stuff outdoors. Reading is something that's really fun for me as well. Crafts, anything like that, are some things that I really enjoy doing.
Awesome. Okay, so what are some previous experiences that make you a strong candidate for this position here with us?
Yeah, so when I think about previous experiences, I really think about my field works. I feel like that's a pretty common thing to draw upon. I feel like the things that I learned in my field work covered a wide range of skills, but also ways to handle situations. Handling things like conflict or creativity and intervention planning. I feel like my fieldwork's taught me how to handle ethical situations. And I feel like all of these things do make me a good candidate. I feel like I have been prepared very well by my clinical instructors to be able to work in a setting like this, in a setting that I really enjoy.
That's awesome. Those are some very good attributes. So, what are some of your strengths and weaknesses?
So I think the strengths and weaknesses, we're supposed to make a play on here, but I feel like in my case it really is genuine. One of my strengths is that I do really care about my patients. I love to get super involved with them. I think about them frequently. I'm always wanting to come up with the best interventions for them and hope for the best outcomes and really push them. But along those same lines, sometimes my weakness is that does bleed over into my home life, my personal life. It can make a work-home life balance kind of more difficult for me in separating those two, because I do often, want to take home my work with me.
I totally get that. That makes a lot of sense. So, can you describe to me your ideal work culture and environment?
Actually, along the same lines of my fieldwork experiences, I had a really great experience that I kind of would love to see my future work culture modeled after. So what they did there, everything was super friendly and super open. We did not have separate offices, so that means all the OTs, all the PTs, SLPs, everybody were pretty collectively placed together, which led for a lot of interdisciplinary communication between all of us. So I always felt super supported whenever I had questions. I knew exactly the people that I could go to. They also did a lot of fun little events just for the therapists and workers to help our morale and, build confidence in ourselves. And I really enjoyed that kind of environment, just feeling like I have support where I'm at and that we're all working together for the common good of our patients.
Okay, so you said earlier about your work-life balance. How do you manage your work-life balance?
As a new grad, I'm sure it's going to be really different from the way I handled things during field work. But that is the closest situation that I have to, compare this to. During field work, it was a fairly big struggle, and I hope to do things better whenever, I'm employed, hopefully, with this company. But when I was there, it was just about, sometimes setting aside even 1 hour to do something that benefited me, whether that was cleaning my house or going on a walk or even just taking a nap or a shower. I think things like that in our little day-to-day is super important, just to continue to make us feel human and let us be our best selves. I do hope to have a little bit more time, to do some of the things that I need to do in my own life now that I'm not doing field work, plus, working another job that helps me pay the bills. But I'm very excited to get to continue to work and explore on how I can balance these two things out.
Yeah, really good. Okay, so what about salary? What are your expectations for that with us?
I know that this is your position and you've been doing this for quite some time now and you're really knowledgeable about it. Why don't you give me a ballpark about where you would normally place an occupational therapist just starting out in this setting.
As a new grad, things can range, but we typically start out somewhere between 60,000 a year.
Okay, that's really good information. I am looking for hopefully something just a little bit higher starting out. Do you guys have any wiggle room or negotiations that can be made?
We can always talk about that in the future. We'll finish up this interview today, and then if we still have some more questions about that, we can talk about that maybe at the end, or when I call you back.
Okay, yeah, that'd be awesome.
Okay, so our company does a lot with continuing ed. So if we were to reimburse you for continuing ed, how would you incorporate what you learned into that into your practice in order to benefit us as a company?
Well, I'm super happy that you said that your company does a lot with continuing education, because I have a lot of ideas on what I would like continuing education on. OT school can only cover so much information, and we learn so much that we want to keep expanding on, but don't always have the time or resources to. So with continuing education courses, I really feel like that could be a benefit to myself as well as this company, because it's going to help me bring in more potentially specialty or niche area patients that might not be able to have anybody else to go to for seeking out certain services, as well as providing better care to patients overall, which in turn would help the company make profit and have better rates, showing our progress with our patients.
Okay. So with your previous experiences, tell me about a time that you collaborated with other professionals to better the care of your client.
So in one scenario, I had a pretty complex stroke patient that at the time was requiring both PT and OT to do co-treatment sessions, just because her endurance was very low, and we had a lot of problems with mobility and movement. So we did a lot of team collaborations there on how to get her to reach the best outcomes and make sure that we were walking that line of being able to get PT and OT within that hour span that we shared together. We worked really well together, and she made a lot of progress. I think we could always wish that our patients could make more, but sometimes we have to understand where our limitations are. And it was a really good collaboration experience for me that I learned a lot from, on how PT looks at situations like that and how they can benefit us as OT just like we can benefit them.
That is awesome. I totally agree. We have both PT and OT here, so we try to do a lot of interdisciplinary care. I think that's really the best for the client, so that's awesome. So tell me about a time that you dealt with a client that was unsatisfied and how you handled that situation.
So there was unfortunately a situation that wasn't necessarily the client, but the client's spouse wasn't super happy that he was going to be working with a student. At this point, I was 11 weeks into my field work experience, so I felt pretty comfortable interacting with patients and treating them with just supervision. And so in this situation, to try to help show the spouse that I was educated and comfortable and confident in doing what I was doing and knowing that I could help treat her husband, I started working on a lot more extensive client education. So every time I did an activity or added something or took away something that we were doing, I tried to thoroughly explain it to the wife so that she could get a better understanding of, hey, here's why we're doing this, and here's the rationale and the evidence behind it. That way she could kind of make that link and see that I am doing things that benefit him, and that did seem to really soothe her mind.
I think that's awesome. I think with this profession, we have to make sure that we do that a lot, because not a lot of people really know what OTs do anyway. So I think having that skill to be able to educate family members and patients is awesome. That's great. So what about a win? Tell me about a time that you celebrated a win, you made progress, hit a goal that you were working really hard to hit with a client or even the family.
Yeah, so I had a patient that I was working with, and I mean, it is hard because I had a couple that really were really big wins that I think I'll remember for a really long time. One patient in particular, he had had several strokes at this point, but was still able to ambulate pretty well. He did have a lot of flaccidity in his right upper extremity. And so we focused a lot on that because that was his primary limitation. So through several weeks, he was at our hospital for nearly a month, and it was almost time for his discharge to come. And we felt like, we had really been trying. We were still holding out hope that he might get some movement back in that hand and arm. And about 3 days before I ended my field work and he discharged, we got some movement back. And the day before that, we had done a lot of kinesio taping, done a lot of weight bearing. We had worked, tirelessly. This was his main goal, was to be able to hold things and pick things up so that he could do for himself. And so whenever I walked into his room and he showed me and grabbed my arm and told me to look at his hand, and I saw his fingers move, that was a really big win for him and for me. It was amazing and really affirming that I got to see progress like that and how big of a difference it made in somebody.
That is awesome. Awesome. Okay, so what about your goals, your career goals? What are they, and how do you plan to meet them?
My career goals is just to feel confident and comfortable with myself as an occupational therapist. I would really like to do continuing education like we were talking about earlier, get some more certifications, just so that I can continue to build my career and build it on things that I'm really passionate about, like women's health. I really like some neuro and stroke. I did have a lot of experience with stroke patients, and those are an area that I'm really interested in. So I think the biggest thing for my career goal is just to keep growing as a therapist and always have a passion for the things that I'm doing.
I think that's great. Okay, and so you just came out of being a student. So what teaching or learning strategies will you implement for your future OT students?
Yes, I think I had a really wonderful experience all the way around for all of my field works. As a student, I think it's important to understand that every clinical instructor has different teaching methods, just the same as the student has different ways of learning. Something that was done with me from my CI was providing me with a sheet to fill out on my first day, just kind of explaining the methods that I like to learn in, the state of my current knowledge, and kind of how I like to communicate and receive feedback. And I found that really comforting for me that she was able to know all of that information and kind of tailor my field work towards me, which was going above and beyond as a clinical instructor. They also showed me a lot of friendship and kindness, so I want to make sure that I emulate that whenever I have a student. Just a lot of patience and understanding that this is a new situation and it's not always going to be easy and that bad days are going to be there. I really just want to make sure that they're confident and have the knowledge to be able to become a competent therapist.
And this will be our last question, and I know we ask everybody, but tell me what drove you to be an OT?
Not to go with the super basic answer here, but I do want to help people. I feel like showing individuals different ways of being able to do situations and problem solving is a really big life skill outside of just what they're dealing with here. Being able to give independence back to somebody who lost it and seeing that in action as I have in my fieldwork sites is really motivating, and that's what continues to drive me to want to be an OT, is just learning all of these new ways in situations that I can apply what I've learned and what I know and make a difference in somebody's life, and then they'd be able to have that skill forever. They've learned something new, and I often learn new things from them. And I think occupational therapy is just a really wonderful way to connect with people and benefit everybody who's involved.
I agree. I think that's a great answer. So, Abby, it was really great meeting you. Do you have any questions for me today?
Yeah, thank you so much. It was super nice to meet you too. I don't have any questions at this time, but if I do think of any, would it be okay that I shot you an email or gave you a call and just followed up?
Yeah, I will give you my email and my phone number here at the office so that you can get in touch with me. I will probably be in contact with you in 3 to 4 days, just depending. But it was super nice to meet you. I think that you're definitely a good candidate for this position. I think you've done well, and I'm excited to see where your career takes you.
Perfect. Thank you so much.